Hi guys, my name is Rachel and I did my project on multiple sclerosis. And a little backstory to why I've done my project on this is because my aunt was diagnosed with MS at the age of 28. So she has been battling this disease for a really long time and I really wanted to learn more about it. So now we're going to get into what is multiple sclerosis. And multiple sclerosis is a disabling disease that affects the brain, spinal cord, and optic nerves, which disrupts your body communication signals. And a little bit more into that, it is when your immune system attacks your CNS and damages your myelin, which you can see in the photos to the right. At the bottom one, you can see the damaging of the myelin in progress. And then at the top, you can see when the myelin is completely gone, which would occur in more of the progressive forms of MS. So the causes of MS are unknown, and it is a lifelong condition that does cause serious disability as it progresses. And according to the ACSM, it affects 2 to 3 million people worldwide. So the epidemiology of multiple sclerosis, we have that most people are diagnosed with multiple sclerosis to be between the ages of 20 and 50 years old, but that doesn't say that this can't occur in young children or even older adults above 50. And it is more likely to occur in females rather than males. Females have 2 to 3 times more chance than males do. And from the sources, they suggest that hormones may be at play to determine this. And it is not an inherited disease, but if someone within your family tree has it, then you are more likely at a chance for getting it. And even though the causes of MS are unknown, I have found from a few sources that changes in the HLA-DRB1 gene are the strongest genetic factors to what cause MS. And if you look to the picture at the left, you can see of some of like the different body where on your body MS would really affect. And then you could still see from the previous slide too what a damaged neuron looks like and what a healthy neuron looks like. And for instance, at the bottom, from a healthy neuron, you can see just a normal person holding, a glass. And then you can see someone who has damaged neurons, the glass slipping out of their hands because they're losing some of their coordination and function. Now we're going to look at the types of MS, and you can see from the photo, these are some of the types and more in depth about what those types are. So if an individual experiences at least 2 relapses, then they are described to have relapse remitting MS. And then 80% of MS actually begins within this phase. And 15 to 30% develop progressive disability, which is with or without a relapse. And then about 15% experience primary progressive MS, which we can see is worsening of, from the start, you just keep getting worse and worse, and you're starting to lose more of those body functions. And then if you look here at the bottom left corner, we can see the expand disability status scale, which is what is used to determine, how much disability has occurred and what phase that they're in with throughout MS. So if you look here, 0, that's normal function. And then you can see towards the end, it could progress as far as death. But really with MS, I feel like you see people within the 2 to 7 category more likely. It's whether you have some function, still able to move and exercise, or you're wheelchair bound and you don't have as much ability to exercise or do some of the daily activities that you used to be able to do. Some of the symptoms with MS, you have fatigue, spasticity, muscle weakness, balance issues, pressure soreness, bladder and bowel dysfunction, pain, dizziness, numbness, and you can also see swollenness throughout the ankles and the legs. Cognitive difficulties, visual disturbances, depression, which I think is a big factor with symptoms for MS and during MS, and then balance and coordination difficulties. So, how multiple sclerosis affects exercise response. So, you can see some physical barriers right away with fatigue, motor impairment, pain, sensory systems, heat sensitivity, balance, and poor coordination. And then you can also see a loss of upper and lower limb isometric muscle strength, lower limb muscle power, lower limb rate of force development, and you really see a reduction in muscle flexibility, more common in patients with spasticity. And then you see decreased muscle strength because of your reduced muscle mass, because you're starting to lose that muscle over time, especially as this disease progresses. And you can also see decreased maximal voluntary contraction because of impaired central activation, which contributes to reduced muscle performance. So, really, since people with MS have, impairment to their abilities. That's why you're seeing so much of these decreases with muscle mass, strength, power, is because they're starting to lose those functions of being able to do, certain things that you used to be able to do. So, how exercise affects multiple sclerosis. Patients can experience depression or a lack of self esteem while exercising because they realize more that they lost a lot of their functions or that they're beginning to become weaker. So it's more of a mental game for exercise in MS. And some patients actually won't exercise at all, which decreases more muscle strength and size. And it could also cause worsening of the MS symptoms. And I feel like um, depression and inactivity go hand in hand, because if they're depressed about their disability, they might not be too into working out because they're so set in that mindset, which is when this would play in more and occur more. So there are benefits of physical activity, though. You cardiovascular risk factors, they're improved, longevity is improved, even your ability to just get around has improved. So I found that aerobic exercise training, wow, that was hard to say, resistance training, or a combination of both, have improved the quality of life for patients with moderate to mild disability. And gait balance and functional training showed improvement as well for those subjects. But there was a weak evidence that patients with severe disability have found any benefits, just because they have progressed so much in their MS disease that, they have more impairment with their functions and more muscle loss and more power loss. They've just experienced more of that. So it's hasn't really had any benefit towards individuals who are within that stage. And I looked more into a research study that was conducted a literature review of 16 publications, which were other studies about progressive resistance training for MS patients. And they found from the expanded disability status scale that anyone who falls below 6.5 showed that they could tolerate the progressive resistance training with no adverse effects. And consistent findings showed that it improved their lower extremity muscle strength and fatigue. But they were unable to find enough evidence to whether the subjects had improvement with their walking ability, just because, as I mentioned before, looking at different types of MS, and if they did fall on that 6.5 instead of, within the lower limits, they might have more of a loss of function. So these are some medications that people can be taking who are diagnosed with MS. You have self-injected medications, infused medications, and oral medications. Some of the self-injected medications are what I'm going to be talking about. I'm going to be focusing more on the interferon beta 1A and the glatiramer acetate. So for the interferon beta 1A, I chose Avonex as the medication. And this decreases inflammation and prevents nerve damage. And then some side effects include headache, dizziness, muscle and body pain, chest pain, and joint pain. And then for glutamate acetate, I chose Coboxone. And this blocks immune system attacks on the myelin. And some side effects include chest pain, fast heartbeat, anxiety, and breathing problems or tightness in your throat. So for my case study, I created Sandy Thompson. She is a 38-year-old female with relapsing remitting MS. So she's in the earlier stages. She was diagnosed with MS at the age of 32, and she wants to start exercising to decrease the progression of her MS. She is taking two types of medication. She is taking the interferon beta 1A and the glutamate acetate that I mentioned earlier. And over the past few months, she has been experiencing more muscle weakness and balance issues while she is walking up and down the steps. And from looking at the expanded disability status scale, Sandy falls within the 3 to 5.5 category of moderate disability. So she still has function and might possibly not need assistive devices. And she has been staying active throughout her diagnosis. She participates in a yoga class 2 to 3 times a week with her friends, and her goal is to improve her leg strength and stability so that she can continue to walk safely up and down the stairs. And she has been cleared for training and does not have any family medical history of MS. She is the first one. So some exercise testing I would perform on her is the cycle ingrometer, the 8RM leg press and lat pull down, and the sit and reach along with toe taps on cones. So the reason why I chose the exercise testing I did for aerobic resistance and flexibility is because they're all very stationary, and she can stay, seated or, in one position so that she's not experiencing any of those imbalances during the testing. And then for toe taps is really to test how much balance loss she has had and whether she is at a fall risk or not throughout the training. So as I mentioned, Sandy Thompson, she is 38, she's 5'7", 150 pounds, and she is cleared for training. So for aerobic, I would do 2 to 5 days a week at 40 to 70% of our heart rate relative. And I would do 30 to 60 minutes and only increase the time to a minimum of 10 minutes before increasing her intensity. And I would have her do like walking or cycling exercises. And then for resistance, I would do 2 days a week at 60 to 80% of her 8RM. And I would do 1 to 2 sets of 10 to 15 reps. And this could be free body weight exercises, machines, or resistance bands, nothing too taxing for her. And then for balance and flexibility, I would do 5 to 7 days. I would do that the most and 1 to 2 times a day, just because I feel that balance and flexibility are really important with a client with MS, because they're going to start to really decrease in balance before anything else, and flexibility. So I would have her do it to the point of discomfort or imbalance and hold for 30 to 60 seconds. And for balance, she could do single leg stance or heel toe raises, yoga. And for flexibility, she could just do some static stretches, like just bending down and touching your toes and stuff like that. Nothing too, like I said, taxing on her body. And then just some things to keep in mind when making the exercise prescription and with also her performing it is monitoring her signs of fatigue, overheating, or worsening of her symptoms. And for MS patients, they actually fatigue more later on in the day. So I would make sure to test her earlier in the morning or the afternoon and make sure it is a client controlled environment, because as I mentioned, they do experience overheating. And then I would also take the medication side effects into consideration, because they are very important. And what you'll see with this next bullet point is taking in enough fluids, because they have bladder dysfunction. Like that's one of the symptoms of MS. So you want to encourage to increase fluid intake to prevent dehydration and hyperthermia. So it's also important to verbal cue and reinforce because some clients may have cognitive deficits. You want to make sure to be, clear and loud, good, like good at a good pace for them to be able to hear and understand what you're trying to explain to them and show them. And as I mentioned, exercise and elevation of body temperature may worsen her sensory and motor symptoms. So it's really important, controlled environment, and make sure that you are not putting too hard of exercises that's going to tax her body. So overall, MS is a very terminal disease and very scary. And from, watching my aunt over the years progress in this disease, it can be very, very bad and severe with disability. She is actually in a wheelchair. She's been in a wheelchair for as long as I can remember. She no longer has any feeling in her legs or her feet. She's very swollen in those areas. And for instance, if she were to get a cut, she would never know because she can't feel it. And I know that a physical therapist actually goes and sees her, every so often. There's not much that he can do. He really just takes her legs out of her wheelchair and kind of moves them back and forth a little bit and then puts them back in. But at the end of the day, she's lost, all of her function in her legs, and unfortunately, she will never get that back. So that's, something that MS is doing to a person. And that's another reason why I wanted to do this presentation, is because, it is such a deadly disease at the end of the day. And you really can't do some of your daily activities if it has progressed to that point. But yeah, so this was my presentation on MS.